My name is Matthew Goldberg. I'm a dermatologist and dermatopathologist and medical director at Castle Biosciences. And in the session today, we'll be covering the comprehensive diagnostic offering from Castle Biosciences, a highly accurate and objective test to help add clarity to the diagnosis of difficult to diagnose melanocytic skin lesions. To start, we'll focus on the issue of ambiguity and discordance in the diagnosis of melanocytic neoplasms. And difficult to diagnose melanocytic lesions are actually a significant problem for dermatologists and dermatopathologists. And it's estimated that of the 2 million biopsies per year that are evaluated by dermatopathologists, there are over 130,000 malignant melanomas that are diagnosed and almost 100,000 melanoma in situ that are diagnosed. But what's often lost in those statistics is that there are 300,000 lesions that are equivocal or not able to be confidently signed out by dermatopathologists, and this leads to significant ambiguity in the treatment plans for the patients who receive these equivocal diagnoses. And the impact as well of this ambiguity is quite significant. And that's because that when you have a diagnosis that is equivocal, it's unclear which treatment plan your patient should pursue. And the allocation of healthcare resources that follow with an uncertain treatment plan can be significant, as well as the impact to the patient. And significantly, it can lead to potential for overdiagnosis or an overtreatment and underdiagnosis and potentially undertreatment. The unmet clinical need here for gene expression profile testing is that we can use additional information to help disambiguate lesions that fall in this orange category and more accurately identify them as being either benign or malignant lesions so they can pursue appropriate management plans that are aligned to the biology of the tumor itself. The comprehensive diagnostic offering leverages the strength of both the Mypath Melanoma assay and the DiffDx melanoma assay by positioning these two gene expression profile tests that are designed to address the same unmet clinical need of difficult to diagnose melanocytic neoplasms. By positioning these two tests in series, first lesions are tested with the Mypath Melanoma assay, which has the strength of 35,000 clinically tested cases and 9 publications that characterize over 2,000 melanocytic neoplasms. And in these studies, there's a reported sensitivity of 94% and a specificity of 96% when you compare the performance of the test to lesions that produced melanoma metastases or not, when you compare the test to clinical outcomes. And in lesions that received a benign result by gene expression profile testing, it resulted in an 80% reduction in re-excisions, suggesting a clear clinical utility for how clinicians can take up the gene expression profile test, change management, and improve patient health outcomes. For those lesions that receive an intermediate score from the Mypath Melanoma test, they can now be tested with the DiffDx melanoma test to provide additional diagnostic clarity and aid in the diagnosis of these difficult to characterize melanocytic lesions. Now, this test was developed using neural network algorithms for the model development and tested on a wide variety of melanocytic lesion subtypes, and it benefits from having a low rate of intermediate results, so that the vast majority of lesions that are sent for testing with the DiffDx melanoma assay will receive a clinically actionable result, which can be integrated into the report and diagnosis of the melanocytic lesion sent for testing in the context of the clinical features, the laboratory features, and the histopathologic context to provide an improved diagnosis that's informed by an objective and accurate gene expression profile comprehensive diagnostic offering. The clinical utility of the comprehensive diagnostic offering has been shown to be slightly different for dermatologists and dermatopathologists. And for dermatopathologists, it can lead to more actionable pathology reports where the pathologist can have more confidence in their diagnosis that's fueled by an objective and accurate measure of the gene expression profile of the lesion that's submitted for testing. And it can help inform the type of guidance that dermatopathologists give to their colleagues in dermatology when they submit a report as final. On the receiving side, for the dermatologists, it can help make your pathology report be more clinically actionable. So instead of having an equivocal diagnosis that may span a benign and malignant type of melanocytic lesion, you can gain diagnostic clarity and identify whether a lesion actually requires additional definitive surgical therapy or can return to clinical monitoring, informed by the synthesis of the gene expression profile test in the context of the clinical, laboratory, and histopathologic features of the lesion submitted for testing, and really inform appropriate management plans for these challenging cases that are submitted for testing. It can also increase the confidence that the treatment plan that you set forward with your patient is the right one, informed by the biology of the lesion itself. And finally, there can be rapid access to the DecisionDx melanoma test itself to provide important prognostic information, and that will inform management decisions for your patients with melanoma. And if you have additional questions and are looking for more information about the comprehensive diagnostic offering or other gene expression profile tests for for your patients with dermatologic malignancies, please reach out to your Castle representatives, or also please contact me here at my email on the screen, and be happy to discuss further with you at any point.